I'm sure all of you have experienced some type of pain, whether it be a headache, neck ache, shoulder pain, or maybe even low back pain. When this happens, we usually take an aspirin or an ibuprofen and then we're fine. But sometimes it's worse. Sometimes we have to go to the doctor and he might prescribe a medication, you might have to have a steroid shot, or maybe even have to have surgery. But have you ever thought of having acupuncture? More and more people are turning to acupuncture as a viable treatment for pain. There has been a profusion of studies done to support this. On this bar graph shows a study that was done on shoulder pain. This study shows the effects of acupuncture on shoulder pain, or that shows the SPADI score index. SPADI stands for Shoulder Pain and Disability Index. This study was done by Lathia, Jung, and Chen. Chronic shoulder pain is a common complaint among adults. Usually the treatments are prescription medication, physical therapy, and as a final alternative, surgery. But acupuncture could be a viable treatment for this. 36 patients wanted to participate in this study, 5 were excluded. 11 patients were tested using standardized treatment, 9 were tested with traditional, and 11 with sham acupuncture. And 3 of the patients in the sham acupuncture group either quit the study either for time constraints or for they felt their pain increased. The subjects were given acupuncture for 6 weeks, 2 times a week. The standardized treatment was designed specifically for each patient, diagnosing where their pain was. The traditional treatment was given to those with the same type of pain, and the sham acupuncture was acupuncture that never pierced the skin. This graph shows the standard and the traditional acupuncture scores dropped on the SPADI score. The patients that had the standardized treatment score dropped 23.8 and the traditional dropped 22.7 on the pain index. The sham groups dropped 6.5 on the pain index. On the disability index, the traditional group dropped 18.1 and the traditional standardized group dropped 17.1. And the sham group dropped by 6.5. As you can see here, their total combined scores were the same on the standard and the traditional. They both dropped by 20.4 points, where the sham group only dropped by 6.5. This graph shows that traditional and standard acupuncture works and is a viable alternative to those that need help with their shoulder pain. But shoulder pain isn't the only thing that can be helped with acupuncture. Neck pain is a common condition among adults. It affects 15% of our population. It's either caused by strain, maybe problems with the disc, or it could be caused by several other disorders. Although there is no definite evidence that the common traditional practices help this, people still turn to muscle relaxants, physical therapy, and a variety of other things. Another study was performed to see if acupuncture was effective in treating the neck pain. They had 9 different groups go over the study. 7 of the 9 said that acupuncture was a perfect alternative to those that needed help with their neck pain. And a positive result in the study was whether acupuncture outperformed the standard treatments. 2 of the studies showed that acupuncture was the same or worse than the standard treatment. But back pain is one of the most common things that people turn to acupuncture for. Acupuncture appears to make the blood flow more easily to the muscle and the tissue. A Cochrane study reviewed showed that acupuncture was effective in dealing with pain more so than other treatments. Acupuncture improved the use and movement of the lower back. It also found that acupuncture combined with traditional treatment made the patient improve immensely over the traditional treatment alone. Acupuncture helps alleviate a variety of different pains. Shoulder pain, back pain, low back pain are all greatly diminished when acupuncture is administered. Acupuncture is increasingly becoming a viable alternative to patients who are seeking treatments outside the normal medical procedures. Without side effects, acupuncture has demonstrated it can be as effective or more effective than other treatments. Do I have any questions?
How does acupuncture work?
Well, there's 2 different theories as how acupuncture works. Ainsworth says the first one is that your body sends pain once the needle is inserted, your body sends pain receptors all to one point and makes you forget about your initial pain. The second one is that when the needle pierces your skin, it makes you forget about the pain.
Does any group support or promote acupuncture?
The World Health Organization has just came out that they believe that acupuncture helps with 19 different disorders or symptoms. And then the NICE organization, which is the National Institute for Clinical Excellence, has come out to say that they believe that acupuncture is very viable in helping all types of chronic pain. And not just low back pain, neck pain, also headaches has been proved to be effective with this. In a study done by Matlock, it shows that all types of pain helps. Patients that have had headaches, their headaches have been reduced by half in just half the time, in just 3 weeks of having the acupuncture done.